Cultural competence is the ability to serve people in an appropriate way. So whoever comes through your doors, you're able to treat them with the level of respect and dignity that they deserve, and that they perceive that the service that they get is done in a way that is comfortable and meets with their standards. So that's essentially what cultural competence is. And the reason why it's important is because we have such disparities in this country when it comes to medical services and as well as behavioral health services. So if we can ensure that our providers do everything that they can in a culturally competent manner, then we can reduce those disparities. So through a contract that we have with the California Department of Alcohol and Drug Programs, our office is able to provide cost-free technical assistance and training to providers to build their capacity in this area, and also to align them with the 14 National CLAS Standards. That's the culturally and linguistically appropriate standards. So as a provider, you may be asking yourself if the people who need your help are actually coming through your doors and getting it. You may be wondering if there's a way that you and your staff can become more knowledgeable about or comfortable with groups that you don't have a lot of experience with. That could be veterans, it could be Muslims, it could be recent immigrants, transgendered individuals, parolees. You may be asking, how can we better recruit and retain these individuals so that they stay for the full length of service that they need, and how can I ensure that I have the staff on board to really meet their needs? You may also be wondering, what are these 14 CLAS standards and am I in compliance? So what we do is to work with you through a detailed assessment that will highlight what your strengths are and what your vulnerabilities are. We will put together a technical assistance and training plan that is very customized and focused to meet your specific needs. And we will send to you a consultant who can work with you on implementing that plan. You and your staff may even be able to receive continuing education credits for doing this work. And then once the work is completed, you will actually receive formal recognition from the California Department of Alcohol and Drug Programs and ONTRACK about your commitment to culturally and linguistically appropriate services.